Today is the International Day of the Midwife, and this year's theme is Midwives Critical in Every Crisis. It shines a spotlight on the essential role nurse midwives play in healthcare, not just during childbirth, but during and throughout a woman's ensured life.
That is right. So today we are joined by Angie Chisholm to share with us how Frontier Nursing University right here in Kentucky is the only nurse wife midwifery institution in the state, which is truly amazing. So we are celebrating the midwives. Tell us a little bit about what midwifery is.
Well, that's a great question, and I think there's still a lot of confusion about who midwives are and what we do. And Kentucky has such a rich history of midwifery, and I don't think most Kentuckians know that. So it's exciting to be here to celebrate this important day. But midwives take care of women across the lifespan, really from puberty up through menopause. And we also do provide a lot of birth care, and that's what people most think of when they think of midwives. But we do things like contraception, well-woman exams, and when we think about midwives critical in every crisis, I like to think about some of the things that are happening in Kentucky where midwives can make a difference. We have a high maternal mortality rate compared to other states, and we need to address that. Part of it is related to access to care. In Kentucky, more than half of the Kentucky counties don't have an OBGYN, a family practice doctor, or a midwife to provide prenatal or birth care. So at Frontier, we're really committed to helping address the crisis in Kentucky of access. And that's one of our goals.
One of the big goals, absolutely. If someone's interested in getting into this program or finding out more, how do they go about doing that? And then we're going to talk about all kinds of fun stuff here.
Yeah. So Frontier trains about 40% of all the midwives in the country.
Wow.
So we bring people in to Kentucky to do what we call clinical bound, but it's after they're already a nurse, and then they're getting into a master's program in midwifery. And that allows them to be a type of nurse practitioner called a nurse midwife. But when they want to come to Frontier to be a student, what they have to do is be a nurse already and have at least a year of experience. And then they just apply to the program, and we have a pretty selective admission process, but it is like an essay, an interview, and those kind of things.
And then once they are accepted into the program, they get to learn different techniques and things. Do you mind showing us just a couple that they will also learn?
Yeah, for sure. So I have a couple things to show you. One, we just brought these to demonstrate that midwives do things like procedures in the office. So we do IUD placements, for contraception. We can prescribe. So that's something that not everybody knows. Right. So we prescribe, contraception, but also, we see people for like postpartum depression, and we can prescribe, medication for mood.
That's what I was going to ask you. Having a midwife for when you're going through postpartum is very vital, honestly, because just talking about some of the things that you all do and having a woman go through childbirth and then struggle to pick up the pieces after, a midwife can help with that, correct?
Yeah. And I do think every woman should be able to walk away from their birth feeling empowered, but we know that that doesn't always happen. And then it's a big transition, having a baby, learning how to care for the baby. And we don't always have the support, in our life because we have busy lifestyles, our partners are working, we don't have the support that maybe we used to. So I can demonstrate some of these things real quick.
Yes.
So one of the important things that midwives do for birth is help people figure out the positioning of the baby so that they have an easier birth. So I'll just demonstrate here with this model first that if a baby, this is the ideal position for a baby to be in to be born, and that opens the pelvis if they're standing or squatting, but if the baby is trying to come out like this, for instance, you can see there's a lot more head that needs to move through the pelvis. So So the positioning of the mother often can be really helpful and effective in facilitating an easier birth. So in the office, midwives will often see the mom, and we'd like to put our hands on them and find out, with their consent, of course.
Right.
But we like to find out, what position is this baby in? And then we also check week to week to notice how the baby is growing. And we'll do what's called like a fundal height. I was going to see if you all wanted to try doing this fundal height and seeing how.
Of course I
would. Yeah, come on.
do a fundal height.
Yeah, so you're just going to be putting this right at the tip of the pubic bone and measuring out.
How far? To
Right
there?
here to the top of the
it.
fundus. Yep.
So it's about 30.
Yep.
All right. So what does that
Sounds
mean? What does that tell me?
So it doesn't tell you anything today, but you could be comparing it from like the week before or 2 weeks before. And if the baby is growing and that fundal height is growing the same each time, then we know that this baby is growing well. But if it was like a 26 last time and then today it's 30, that could mean the baby's growing faster or there's extra amniotic fluid.
So if someone is interested, again, before we run out of time, tell us how we can sign up for your wonderful classes.
Yeah, so you want to go to Frontier Nursing University's website, and there is information on there for the application. And if you just want to find out more about what we're doing in Kentucky to address some of this access to care issues, then you can go to the Midwives of Kentucky website.
Excellent. Thank you.
All right,
so
thank
much.
you all so